Hi, my name is Tori Fraser. I currently work as one of the quality and risk managers at Hillcrest Hospital, Rockhampton. My journey began in Ramsay in 2018 when I started my graduate registered nurse program here. At our facility, our program actually goes across all of the departments. We do a rotational, about 8 weeks in each department, just to try and find where you belong, as well as have those skills to be able to backfill staffing if needed. I then eventually found my home after that grad year in surgical ward with an interest in PACU as well. Following this, I then did my ALS and became an after-hours supervisor, doing weekday supervising as well as weekend supervising. Learn a lot of management skills. I was quite young when I did it as well, so it was a bit of a learning curve for me, with communication and doctors and everything else. Really matured me into the nurse that I am, and um, my values of speaking up for patient safety. I am a pretty confident person anyway, but yeah, had a lot of learning experiences in there. After supervising, I then did a job share nurse unit manager position. It was like a week on, week off kind of thing. It worked for both myself and Angie, just with her family, and I could still do after hours supervising and that as well. So then I did that for about 12 months. I then got married and fell pregnant. I went on early maternity leave, with pregnancy complications. I now do, fortunately, have a young family. During my maternity leave, the opportunity arose for the quality and risk manager here at Hillcrest. Um, it aligned with my leadership goals, like my career goals. It also, had the flexibility, that I needed to support my family. My husband works away, so I just needed the flexibility, but also it was still within my leadership goals, and I could still have, the ability to work on the ward and still be nurse unit manager acting if I needed to. It's actually been a really rewarding transition, and it's probably reinforced my passion for leadership within the healthcare system, honestly. This NLOT program, so I see an opportunity to further my leadership capability and gain a deeper understanding of my own kind of leadership style. I am particularly interested in strengthening my communication skills, learning effective strategies for managing complex situations, and just to grow as a leader within Ramsay. I have known a few people to do this program as well, and they say it's such a great opportunity, not only for the learning opportunities, but to create a support network within the Ramsay group as well. And I feel really strongly about broadening my horizons and, being in contact with other leaders to help me develop further. My long-term career goal, I've always wanted to do Director of Clinical Services. I have an amazing DCS, Chrissy Kelly, who is so driven and so passionate about her job, and it really makes me want to be the kind of leader that she is. If that wasn't an opportunity, I would also be looking at like a leadership role within NCGU. So yeah, I am looking to progress my career in leadership and management, and I think this NLOT program would really help me with this. My kind of leadership approach is probably a combination of like a situational leadership and a clinical governance principles kind of leadership. I try to recognize every individual and team and situation differently because they are differently, and I try to adapt my leadership style according to that. Um, I love mentoring new staff. I love being a support person for staff members to come to. I have an open door policy. I've built really good relationships with staff members, being a nurse unit manager, and being, their direct person to come to if they need. Very big advocate for speaking up for patient safety as well. And I do think that, my presence anyone is happy to come and have a discussion with me, or, ask me for help if they need to. Obviously, I do have a strong focus on patient safety and quality improvement as well. How do I model the Ramsay way? Within my work as well as home life, I love the phrase people caring for people. I have a little daughter, and I try to enforce that in her as well. I promote accountability, transparency, and learning. I'm continually reflecting on my practice management or whatever that would be, and seek opportunities to improve. I really believe that these principles strongly align with people caring for people, and are values that I endeavour to demonstrate every day, as I said, in my work life as well as my home life. I've been very fortunate to have Chrissy Kelly as my DCS. She is very, very strongly supportive of me doing the SENLOT program, as well as, striving to be a manager. She wants everyone to succeed, and I would love to continue that view. I want all of our staff to be happy and succeed at whatever they want to do, whether that's stay as they are or progress into management. And yeah, I think I can contribute more broadly to Ramsay's future. Thank you so much for your time, and I hope that I hear from you soon. Thanks.